It is 9:36. We are going to get started. Clerk, roll call, please.
Vice Mayor Baxter,
Here.
Commissioner Flores, Mayor Marino, Commissioner Powell, Commissioner Sachs, Commissioner Weiss,
Here.
Commissioner Woodward.
Here.
Thank you.
I'm going to have Commissioner Woodward do the invocation and the Pledge of Allegiance.
If you're able, please stand. Dear God, we are meeting today to conduct matters of business for our community. Guide our hearts and our minds in the spirit of fairness. Impart your wisdom upon our activities so that our affairs may reach a successful conclusion. Thank you for being our source of guidance today. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Administrator Bonlaren, do we have any additions, deletions, substitutions?
Madam Vice Mayor, there are no additions, deletions, or substitutions to the agenda.
I'll move to accept the agenda as presented.
Briefly, I would like to ask for a motion to reorder the agenda so that we could take public comment first, giving Commissioner Powell a few extra minutes to arrive.
So moved.
All in favor? The motion was made by Commissioner Woodward, the second by Commissioner Sachs. All in favor say aye.
Aye.
Any opposed? See that the motion carries
No, we have to adopt the agenda.
first and then reorder? Okay, so we will do this again. May I get a motion to adopt the agenda? A second? First by Commissioner Woodward, second by Commissioner Flores. All in favor say aye. All opposed say nay. See that the motion carries 5-0, please. Do you want us to reorder it again?
Nope, we're good. You can just bring up
Okay.
public comment.
All right, so we are going to start with public comment then, if Commissioner Woodward would please.
Okay, we will start with Jason Cambrell and Don Chester.
Good morning, Madam Vice Mayor, members of the commission, staff. First of all, thank you for doing what was needed to implement this emergency meeting. We know it took time away from your family for those families across our community. Today I'm standing before you to represent all of the hospitals, north to south, east to west. Over the last 4 years, Palm Beach County has supported participation in Florida's Hospital Directed Payment Program, or DPP, a program that historically allowed our county's facilities to get about 80 cents on the dollar in reimbursement for Medicaid services to the low-income, most vulnerable patients across our community. The One Big Beautiful Bill Act leaves open a brief window of opportunity for Florida hospitals, just like the ones that are represented in this room today, to get reimbursed the full cost of care for Medicaid patients. But our state determined that our hospitals must be the ones to fund it through local assessments like the one before you today. By acting now, Palm Beach County ensures our county's hospitals do not miss out on this very important, critical chance. The vote enables our facilities to end Medicaid losses as we provide care to all, regardless of their income. This opportunity comes at no cost to the county or any citizens. It brings the federal tax dollars we all paid back to our county. Again, on behalf of all of the hospitals represented here, all of those in the county, I'd like to thank you, Madam Vice Mayor, again for your leadership. Thank you for the commission and staff very much. Thank you so much.
You have to give me a minute to raise this up. I normally just do this for slam dunk contests, but for you, I like to be able to see everybody. First of all, as Jason said, thank you so very much. This is a special meeting. It was called just a very short day, a few days ago, and it's part of your time. And It's getting close to holidays also. But it's incredibly important to our hospitals to take care of it. As an example, Medicaid patients, and this is going to impact Medicaid patients, other than the 4 licensed children's hospitals, Nicholas Children's, All Children's, St. Mary's treats the highest percentage of Medicaid patients in the state of Florida. Over 37% of our patients are Medicaid because we treat a lot of children, a lot of OB, and we know, based on the bill, whatever it is that comes out of Washington, there'll be either more patients that are on Medicaid or a lot less, and there'll be charity cases, and they'll come to our hospitals. We also fear that they're going to come sicker because they won't want to come to get care right away. So we are very, very grateful to the County Commission for considering this, and we hope that you will approve it. I don't want to take any more time. We've also had, Commissioner Sachs has asked me about mental health. Okay, so I'm going to bring it up for you, if you don't mind. And we've committed to, along with Joe Abruzzo, I'm not sure what the title is right now. Clerk right now, okay. To convene a meeting because we need to be able to treat children 12 of age and under here in Palm Beach County who have mental health illness. There aren't a lot of them, but we'd like them to be here. So we will commit to meet with him to do our best to find a solution in an interim until the healthcare district builds their facility out west, which, they said it's going to take 2 years. No construction in Palm Beach County takes 2 years. It's going to be a lot longer, but that's okay. In the interim, we want to be able to make sure that these children can be taken care of here in Palm Beach County, closer to home, closer to their families, and they get the care that they need. So thank you very much for meeting today. I know it's a bit unusual. I know it's a very short notice. Commissioner Baxter, thank you so very, very much for helping this. I know Commissioner Marino is out of the country, but I know she supports this from talking with her. So if you have any questions, I'd be glad to answer them. If not, I thank you so very much for your time.
Commissioner Sachs.
Thank you, Vice Mayor. And thank you, Mr. Chester. And it is correct that we are not going to forget mental health for our children here in Palm Beach County. We have your commitment from St. Mary's and also your legacy here in the county as someone who is an advocate for many here is a legend. As well as from Baptist Health. I spoke with Don White very, very briefly, and Tennant and all the other major hospitals here in the county that we, with the county staff here, will work together to make sure that we have coverage of mental health for our children. Thank you so much for that. Thank you very much, Madam Mayor. Thank you.
Of course. I just wanted to say thank you for bringing this to our attention. It is crucial, I think, for the residents to, that we do this today. So just thank you so much for that.
You're quite welcome. And we thank you. I know this is highly unusual, but because of what is happening in Washington, the timing had to be moved up. Normally, we would do this in September with the regular session, but because of what is happening in Washington and not being really sure what's happening in Washington, we wanted to make sure that we brought this up now. So thank you for changing your schedules around to being here this morning.
Thank you. Oh, Commissioner Flores.
Thank you. Good morning, Mr. Chester. Thank you for making that commitment. My question to you is, for clarifying purposes, what was actually the commitment you just made to us
Sorry, I couldn't quite hear.
regarding the mental health for our youth?
They can go over the agenda item.
Your commitment, you say we're committed to,
Well,
so what does that commitment look like?
Sure, we're gonna, we, the hospitals, are gonna get together excuse me, Reggie Dern is going to convene the meeting as an assistant county administrator and try to find a solution where these children can get inpatient care. We know they're getting outpatient care in various other places. It's not an easy thing to do, to provide mental health care for someone of any age. It's specialized facilities, it's specialized treatment, it's specialized people who have the skills to take care of the patients. And we have to have their commitment. We can't just say, hey, we're going to do this and we're going to build a facility. You have to have the professionals who are willing to come to that facility to take care of the kids. And we have to, work with the physicians, and that's going to take some time, but we're committed to doing it as best we can until the healthcare district opens their facility in the coming years. And, we support them. 30 or 40 years ago, I was one of the handful of people that got the healthcare district started, which we truly needed. So I believe, I'm not going to do it myself. I can't, and I wouldn't try to. But I believe together, all of the hospital systems can come up with a interim solution until that facility opens in a couple of years.
So thank you for that, and thank you for leading in that effort. Am I to understand that this is just St. Mary's that you're speaking on behalf of, or are you speaking on behalf of all the hospitals?
All hospitals, not just no. We've talked, the hospitals, and it's several systems that are talking, plus individual hospitals. And we've all committed to find a solution, because we have the children, we don't want to send them out of county.
No, we don't.
We want to make sure that we have a facility, but it's not just the facility. The key is the staff, with the expertise to take care of the children. Adult, that's why we have pediatric units rather than just adult units. And because they're not little adults, as a pediatric emergency room doctor explained to me at one time. And that's why we have pediatricians. And so we want to make sure that they get the level of care that they need to whatever, I don't know that much about mental health patients at all. I'm not sure too many of us do, but we know we take care of patients, and we want to make sure that they get the care that they need here in Palm Beach County. So you have our commitment to work with the county. I'm not sure, County Clerk Abruzzo, I think I'm got it right now, and I spoke just before this, and he said that he would convene the meeting.
Excellent. I think Mr. Duran's here. When are we scheduling this meeting? I just want to put everything on record today.
Sure.
I don't want any more wishy-washy stuff here.
Well, Commissioner, we don't currently have that meeting scheduled. However, immediately after this meeting, I'll be meeting with individuals with the hospitals to ascertain a time we can meet. My thoughts are to meet as soon as possible to expedite this solution, because it's been going now for multiple months, and it's time that we found a solution. So thank you for your support, Board.
Thank you. I look forward to this meeting occurring, and hopefully you can give us a report back. So
Absolutely,
thank you.
sir.
Meeting.
And if you could let us know when the meeting will occur, as soon as you guys have a date and time.
Yes,
Thank
ma'am.
you.
Yeah, I have to tell you, about 9 o'clock last night, I sent the administrator an email saying, you're going to convene a meeting for us. So this has been very short notice, but again, we appreciate your commitment to working with us, with the county's commitment to help us take care of the kids.
Commissioner Sacks.
I want to thank Clerk Abruzzo for starting this conversation today, and also Mr. Chester. Chief Durden, you'll let us know next week when the meeting is going to occur, and that way, whatever we can do, because it should be convened. No, you don't have to come up, sir. It can be convened by you, because you're county, and we'll invite members of the of the whole hospital group here, because this is an issue that is important.
Yeah,
I appreciate it. You don't need to convene that meeting, Mr. Chester. We'll have the room, we'll have the coffee, and I'm sure Chief Durnan will give our Vice Mayor notice so that we can all know that it's occurring. And thank you again, Clerk Abruzzo, for bringing this up. Thank you, Mr. Chester.
You're quite welcome, and thank you for confirming that the chief will convene the meeting, because I'm not sure he saw the email I sent to him at 9 o'clock last night asking him to do it.
You did now. Thank you.
Next up.
Okay, we have Dawn White and David Elliott.
Thank you all. Thank you all. Again, we, the hospitals, thank you, because this is not this is a meeting that was not scheduled initially, and it was done at a very short notice. Now, we have somebody else.
Thank you.
Go right ahead.
Thank you, Don. First, just a moment to thank Don Chester for everything he does for our community and our industry. Thank you all for being here. Your commitment to our hospitals, we recognize and are deeply, deeply grateful for. Thank you all. And I just want to be very clear. Baptist Health does not provide inpatient pediatric care today. We take care of any person that enters our emergency room and needs care. And in the case that is a child under 12 that is Baker Acted or needs to be Baker Acted, we work with that child, family, guardian, to find proper placement for that child. In some cases, it's not inpatient care, as we know, and in some cases it is. What we are committed to do, and we committed this last week with Interim Administrator Bonlarin and with Administrator Duran, Assistant Administrator Duran, we are committed to sit down with the administration, with the district, and with our fellow hospitals. Talk about this problem, understand this problem. I was not aware of this problem until we started talking about the directed payment program. But we are absolutely committed to sitting down. We serve this community in any way we can to better the health and welfare of the people in this community. And that commitment would not change having a conversation about this topic. I thought I should clarify.
Thank you. Commissioner Flores?
If you could state your name for the record. If you could state your name for the record, I don't think you introduced yourself.
I'm so sorry. I thought it was called Dawn White, and I'm with Baptist Health.
And we have your commitment that you will participate in this conversation.
Absolutely. Okay. Baptist Health is happy to be a part of this conversation.
You mentioned that you didn't know about this issue. And
I was not.
And that's concerning to me, because we've had various conversations, and for a major hospital not to know, it's a little concerning. So I hope that when we have this meeting, we have 100% of all the hospitals, and not just a person, but decision makers at the table. So thank you so much.
Absolutely, and I'm certain that all of the hospitals, we've already had this conversation. We're committed to a real working meeting with the county and the district on this topic, on this subject. Thank you.
Thank you. David Elliott with Adelanto Healthcare Ventures. We're a consulting firm that represents many of the private hospitals here in Palm Beach and across Florida. I want to second everyone's comments first and foremost by thanking you all for not only meeting today, but your continued support of these programs. These local assessments that we do here are so critical for the hospitals in the community. As everyone has expressed, this is a program that helps make up the cost of treating Medicaid patients. It allows the hospitals...
Mr. Elliott, would you mind pausing just for a second? Would you pause his time so we're not robbing him of his time? Did we find it?
Yeah, it's off now.
Okay.
We had a loud beeping back here, sorry.
It was a little distracting. You may continue, thank you.
No problem. This is such an important program because it allows the hospitals to recoup the cost that goes uncovered otherwise for treating Medicaid patients in the community, and allows them to continue to be the safety net that provides the services that we're discussing today. You'll note that the rate that we're recommending for today is significantly higher than it's been in past years. It's close to $300 million in assessments on the hospitals, rather than about $90 million that it was in prior year. Again, this is a program that allows hospitals to pay these assessments themselves rather than having any kind of tax on the community or any cost incurrence from the county. This is all from the hospitals. Is that 3 minutes?
Please, it wasn't. Please continue.
Okay. These increased assessments are because the opportunity to fully achieve cost for these Medicaid patients is narrowly closing. This big, beautiful bill that is about to pass would limit hospitals from being able to access these dollars in the future and be able to attain the full cost of treating these Medicaid patients. We have a narrow window to do so right now and help these hospitals be able to get to 100% of cost. These increased assessments are necessary to fund that program, and again, that does so without any cost to the taxpayer or the county. We appreciate your continued support. I'm available for any technical questions about the assessment or kind of how this works statewide. But again, just want to thank you all for your support.
Thank you so much. Do we have any more cards?
We have one non-speaking card. That's all the speaking cards.
Thank you. Administrator Bonlaren, do we have a staff presentation on this item? And Commissioner,
I'll defer to Commissioner Flores and then come back to her.
okay, Commissioner Flores.
I'm sorry about that. I was told I had to stall today, so I have a bag of questions.
Oh, and Commissioner Powell is here. Please let the record reflect Commissioner Powell has joined us.
So my question is to the gentleman who was just speaking. You said that you represent a group of hospitals. Which hospitals do you speak on behalf of?
So we work with all of the hospitals in the local community. So when we're recommending a rate to be set, we speak to all of the hospitals in the community. We ensure that there's full support for these assessments. For who we actually represent, it would be HCA, Baptist, and Tenet, I believe.
Okay, thank you.
Yep.
So the answer is yes, Vice Mayor, to your question. Just a very brief presentation that we have, and then I had a quick comment that I wanted to follow up at the end of the presentation.
Sounds good. Thank you.
Okay. Good morning, Vice Mayor Baxter, Commissioners, and Interim County Administrator Todd Bonlaren. Thank you for accommodating today's emergency ordinance, amending the current local provider participation fund ordinance by adding additional non-public hospitals that will be subject to the special assessment and further waiving the notice requirements outlined in Florida statutes by a 4/5 vote declaring that an emergency exists and that the immediate enactment of this ordinance is necessary. In order to maximize the opportunity for Palm Beach County hospitals to receive additional Medicaid funding in support of treating patients and improving outcomes. The current budget bill moving through Congress provides for this additional funding only if certain steps are taken by this board prior to the federal budget passage, which essentially entails raising the current maximum amount which hospitals are assessed in order to receive a greater match from the federal government. Additionally, this item approves 2 additional indemnification agreements, provides the 4th Amendment to an ILA between the county and the healthcare district. I'm not prepared to answer any questions that you may have.
Commissioner Sachs.
Thank you so much. I always want to call you Chief Durnin, if you don't mind. What is the reasoning behind 3AB, the indemnification agreements with these 2 entities, sir?
Commissioner Sachs, I'm sorry, excuse me.
He's the chief, whatever he says.
No, I just
everybody
didn't
can
address
speak.
who's at the table with me, and I apologize. I'm joined by County Attorney's Office, Helene Zvid, as well as our latest attorney assisting us, Jessica Bober Rosenthal. So, Helene?
Thank you very much. I'll address your question, Commissioner Sachs, because it is more of a legal nature. The hospitals have asked us to issue a special assessment. Traditionally, special assessments are used for capital improvements, for roads, for sewers, for other capital improvements. The hospitals in this case are using this special assessment to increase a reimbursement for Medicare expenses. So it's slightly different than the normal way that we see special assessments. In order to protect the county, we have thorough indemnification agreements from each and every hospital, indemnifying us for any possibility. So those two indemnification agreements will include the 3 new hospitals' indemnification of the county. We already have agreements from all of the other 13 participating hospitals.
So the excellent explanation. I appreciate that.
Thank you.
The 2 that are set aside, those are just entities, medical entities that are separate from the other hospitals in the county. Is that correct?
Well, these 3 hospitals are being added to the 13 that are currently listed in the ordinance. So that's all that the amendment to the ordinance does. It adds these 3 new hospitals. Every private hospital has to participate or this program doesn't work. It can't move forward. So because 3 new hospitals were licensed, we have 2 indemnification agreements. 2 of them are owned by the same entity, the
Very
Behavioral
good.
Health.
Excellent. Thank you for that explanation. Thank you, Vice Mayor.
Well, thank you. I do not see any other Administrator Bonlaren.
Thank you, Madam Vice Mayor. And first off, one, I wanted to thank our team. I wanted to thank Mr. Duran, Helene, thank you so much. Ms. Vid, great having you new to the team. Jessica, I think you came on board yesterday on this item, so that was great. Thank you to Clerk Abruzzo for your swift and quick action in putting this particular meeting together. And I also want to thank some of the hospitals. We had an opportunity to speak to a number of the hospitals. I was involved in the front end of this when we first did this resolution or the ordinance, and then subsequently here. And it was great. You know, we've had really good dialogue with our hospitals, particularly in times where we've had emergencies. You know, during our pandemic and when we've worked with these issues, the dialogue has been good. But sort of in the in-between place, one of the things that really came to our attention was there was a lot of strategic priorities in the health space that we as a county work on, that this board brings up. There's a lot of priorities, too, that our hospitals do as well. And so I felt like there was a little bit of a disconnect there in terms of that conversation. So it was great to see the back and forth about starting this dialogue. And hopefully it's more than just one meeting. Hopefully it's multiple meetings that culminates into coming back to the board in a workshop setting and doing something a little more regularly, because I think the connectivity between the county, the healthcare district, our hospitals is so vital to making sure that we have a robust health network that's supported by both public and private entities in the community. And I want to thank the board. I mean, this would not be possible without your action. This is a new funding source that's coming down to our hospitals. We want to support them in every way they can, and we look forward to working with them going forward and brainstorming of new ideas, existing ideas, and also being accountable to those dollars to share with you and the community of exactly how we're using those dollars and the great ways that they're proposing to do that in the community. So I just wanted to say some thank yous and look forward to that continued dialogue.
Thank you. Commissioner Weiss.
Thank you, Mayor. I'd like to go ahead and make a motion to move item 3A1, A, B, C, and D.
I have a first by Commissioner Weiss. I have a second by Commissioner Woodward, and comments by Commissioner Flores.
Yeah, I just want to echo our administrator's comments regarding the dialogue. As we've exemplified here, this matters to us because we were able to call an emergency meeting after we received calls, I think on Monday, to try to move this as quickly as possible. And I think from the county standpoint, we're committed. We're committed to helping our community, our hospitals, our stakeholders, and we acted swiftly. What I would like to see is the line of communications go both ways. And I think it was in November, we got a 30-day notice that we were closing down a mental health being provided at one of the hospitals in the north part of the county, and unfortunately was pretty much the only provider in the county. And we were left to try to figure out what we were going to do. I hope that this is a partnership. We're all invested in our communities. And I don't think that was fair, that we were given a a 30-day notice via a letter. So what I would like to see is this committee, hopefully it's a committee, something that is perhaps quarterly, semi-annually, I don't know what that looks like, but that we have decision makers at the table with the county so that when something like this comes about again, we are not, left to try to figure it out in 30 days. I think providing health care to our residents is a priority for everybody on this board. So we rely on you, the hospitals, to be able to provide that. So I want to see this be a partnership between all of the hospitals and the county and every entity that is in contact with us. So that's what I'm asking for here today. I think you've heard some of the comments here today. And I'm happy to be able to get this done in a quickly fashion as we did. And I'm extremely proud of the board for being here. I'm glad that nobody else left on vacation a little early, so we were able to get it done. Thank you.
Thank you. We have a motion and a second to approve item 3A1, A, B, C, and D. All in favor, say aye. Aye. And any opposed, say nay. Please see that the motion carries 6-0. All right, thank you, everyone. Meeting is adjourned.